Why is it important for women to take folic acid? Let's find out. During early fetal development, a neural tube forms that later becomes the spinal cord, the brain, and other protective structures. It's supposed to close by around the 4th week of pregnancy. This is before some women even know that they're pregnant. Neural tube defects are major birth defects of the brain and spine that occur early in pregnancy due to improper closure of that embryonic neural tube. The most common neural tube defects are anencephaly and spina bifida. Anencephaly is an underdeveloped brain and skull. Spina bifida is an incomplete closing of the spinal cord. Folate is a water-soluble B vitamin, specifically vitamin B9. It is used for the regulation of DNA synthesis and function, and also to help modify proteins. So our bodies need folate to make new cells. Daily folic acid supplementation around the time of conception has been shown in randomized controlled trials to prevent neural tube defects. Folic acid supplementation prevents about 1,300 annual births from being affected by neural tube defects. The terms folic acid and folate are used interchangeably. However, folate is the general term used to describe the many different forms of vitamin B9. Folic acid is the synthetic form of folate. Folic acid is also used to fortify foods such as rice, bread, pasta, and some breakfast cereals. Folic acid is ideal to use for food fortification because it is more heat stable than the other types of natural food folates. Foods that are naturally rich in folate are dark green leafy vegetables. Think of spinach, kale, broccoli. Also in legumes, which are beans, peas, lentils. Also in citrus fruits, bananas, avocados. Women should eat a diet that is naturally rich in folate from their food. However, most women do not receive the recommended daily intake of folate from their diet alone. All in all, the ways to get folic acid into your body are through vitamins that contain folic acid, eating folate-rich foods, or eating foods that have been fortified, or a combination of all of the above. Okay, now for the final summary recommendations. Number 1, the U.S. Preventive Services Task Force and the CDC recommend that all women planning for pregnancy or capable of pregnancy take a daily supplement containing 400 to 800 micrograms of folic acid every day. Number 2, supplementation should begin at least 1 month before getting pregnant and continue 3 months into pregnancy. And number 3, for women with a prior history of a pregnancy with a neural tube defect, the recommendation is for her to take 4,000 micrograms of folic acid per day. So that's 10 times the dose. You should also speak to your doctor and genetics counselor about your chances for having another child affected by a neural tube defect and any specific prevention steps that you can take. Okay guys, I hope that helps. I'm Dr. Derek Haas. Please come see us at Conceive Fertility Center if you have any questions.